Hello, good evening. Today we are going to discuss the case of Miss Amy Vineyard. So we go directly to the writing task, what we have to include here. The writing task we have, yes, using the notes. Just a minute. Using the notes, write a letter about Miss Vineyard's situation and history to new community health nurse. So you are going to write a letter to new community health nurse. It means new community health nurse in the sense you're not going to update information to the community health nurse who was in charge of taking care of Amy Vineyard. Instead, you're going to write to a new community health nurse. So if you are writing to a community health nurse who is known to this person, you would not have included her past history. So here we need Vineyard situation and history. So history is very important here because you're writing to a new community health nurse. You're going to introduce Ms. Vineyard to a new community health nurse. This is something very crucial here. It's not updating the situation to a community health nurse. So we are going to introduce Ms. Vineyard to a new community health nurse. Okay, that's it. Let's go ahead and see. Just a minute. Let's go on top. We can see, yes. Miss Amy Vineyard is a patient in your care at St. Kilda's Women's Refuge Center. So it's a refuge center. It's not a hospital. You're working in a refuge center where ladies can come and share their problems there. So she's 6 weeks pregnant. She's 6 weeks pregnant with her first child. So this is her first pregnancy, and she's 6 weeks pregnant. She presented 2 days ago. It means that today we are writing the letter on 8th of January 2009. 2 days ago, she presented 2 days ago. Yes, exactly, 6, requesting help for her substance abuse problems. So we can understand in brief, we understood that Miss Vineyard has substance abuse problems, and she is 6 weeks pregnant with her first baby. So because she realized that she is pregnant, she wants to get rid of the abuse, the drug use, the substance abuse. So she has a desire to reduce or cease her alcohol consumption and decide to reduce and cease her drug use. So this is what we can understand in brief. But no desire has been indicated to decrease or stop cigarette use. So she is not currently in a state to reduce her cigarette use, but she is ready to cut down the units of alcohol she consumes, and she's ready to cease her drug use too. And this is what we can understand. Now she wishes to be discharged. Okay, so 6th of January she came, and 8th she's going to be getting discharged. But she needs our ongoing support to her pregnancy. Now, this is her first pregnancy, and she's very prone to drug use. Substance abuse clients, they may go back to substance abuse, and this may harm the child. For this reason, you need ongoing care and support from your facility. This is what we can say. Now, just 21, she's just 21, admission, pregnant, substance abuse is a diagnosis, and the discharge plan is here. Now, daily 2 weeks, at least for 2 weeks, she needs to get community mental health nursing for at least 2 weeks. This is something very serious because she has depression. You can see that feeling depressed, history of depression. She has a history of self-harm. Um, she has a history of suicidal thoughts. So you need because and she's too vulnerable. She just realized that she's pregnant and she needs utmost care from the community mental health nursing services. So this is what we need. First, patient wishes to continue living with her friend. So it means that she is living with her friend in so far. And yeah, depression, methadone program, first trimester ultrasound, maternal health. All these things are important. Now, when go with the reason for admission, we can see that she realized that she got self-admitted to the refuge center with her concern about the pregnancy because her pregnancy test confirmed that she was 6 weeks pregnant on 5th of January. And all these things, you can see that this is pregnancy and pregnancy-related problem as well as some sorts of drug abuse problems. You can see there. You can see pregnancy-related problems as well as drug abuse problems. But when at your refuge center, you have monitored her blood test, counseled for HIV, nutrition, possibility of rehabilitation. Okay, all these things we have done at our care. Now, this is her history. So you have history from here, lifestyle and history. You can see a lot of things here. That's nicotine, that's cigarettes, 30 to 40 cigarettes. And she has been a chronic smoker since she was 15. She is known to cannabis, amphetamines, cocaine, heroin, all these things, and she started using, alcohol. 15 to 16 years, she started using these things, and now she about her contacts, her communications with her parents. She has no contacts, very limited contact. And she has a history of suicidal thought and self-harm in the past, but has never seen a psychiatrist. So we got a brief history that the main thing that we need to make aware of the new community nurse is that she's 6 weeks pregnant. She has drug abuse problems, and she has she needs some mental health support throughout her pregnancy, and she needs to be taken care until the baby is delivered safely. And this is what we need to understand. Let's go with today's date. Yes, this is a letter. The address is Lucy Van, registered nurse, community health nurse at Center St. Kilda. And we go with the letter here. Yeah. Dear Miss Van, reference Miss Amy Vineyard, age 21 years. Yeah, go ahead. And this is the letter that we have written to the new community health nurse, Lucy Van, writing to introduce Miss Amy Vineyard, who requires ongoing support throughout her first pregnancy. So here we have indicated that she is being pregnant for the first time. And we indicated that she's pregnant, first pregnancy. And the requirement we have written here requires ongoing support throughout her first pregnancy. Okay. So because she is not known to the new community health nurse, we use the word introduce, or else we could use with regards or in regards or refer or something like that. Now her diagnosis is here. She has been diagnosed with substance abuse and is being discharged today. So the diagnosis, pregnancy, substance abuse, it is given in the case note. We just said substance abuse, because we already said first pregnancy here in the previous sentence. So I don't need to write pregnant substance abuse like that. So we have already included pregnancy here. So we have substance abuse, and it's been discharged today. So when she's getting discharged today, that's on 8th of January, 2009. Now, Mrs. Vineyard lives with her friend, and this is her history, brief history. What is she, where she lives, and what's her habits? And she lives with her friend and has limited contact with parents. He's a heavy smoker. You can use brackets. It's not counted in the word. As well as an alcoholic. I have not used chronic alcoholic. So, and I have not mentioned the units because it's not significant. She is a heavy smoker. It's a habit. Even though it is, abuse, I can say that smoking, alcohol, cannabis, amphetamine, cocaine, all these things are. I'm not going ahead with the doses, but I have. I went with the number of cigarettes because that's such a huge number per day. So that's why I have used it in bracket. So I have not mentioned the units of alcohol. You can include that if you need, but the word count will go higher. So that's it. I just want to inform that she is a smoker, alcoholic, and she used drugs such as these heroin, all these things. Okay, that's what we have said. And that she started now she's 21, and for the past 5 years she's using. So this is what we have mentioned here. So it's she has a long history of using these things. And despite having the history of self-harm and suicidal thoughts, she has never consulted a psychiatrist. You please be aware, be very careful using these connective despite or in spite of. Many of my candidates have confusions in using despite or in spite of as a connective, because if you are not particular with the usage, please don't use it unless you are thorough with the usage. If you are not thorough with the usage of despite or in spite of, please don't use it in your OET letters. It may cause more trouble. So this is the first paragraph was about the past history and her habits. Now let's go ahead with the next paragraph now. That's the recent history now. What happened now? Vineyard was confirmed 6-week pregnant on 5th of this month. So this was the day. And the following day, she sought admission in our center to get rid of her substance abuse. And she was worried about the pregnancy. And suddenly, when she realized that she was pregnant, she got aware that she needs to care her baby, and she is right now willing to get rid of the abuse. So substance abuse, I mean. At our care, she agreed to reduce her drug and alcohol usage, however, she still is not ready to quit smoking. Now, you can definitely include, if you want, you can include that she has some problems she had when at the time of admission. She had some problems like pregnancy-related problems or drug-related problems or something like that. If you need, you can. But you right now we have a lot of things to include. That's why I have not included that. Okay, so we carried out. We have given her nutritional guidance, counseling regarding HIV and sexually transmitted diseases. Now, my requirement paragraph in my request paragraph, as per the discharge plan, as upon discharge, I would like you to provide Ms. Vineyard community health, mental health service daily for at least 2 weeks to tackle depression. That she is depressed right now. So to tackle depression and involve her in methadone program, Alcoholic Anonymous meeting. Yes, yeah, that's something which was given in the case note. So some programs were mentioned. So please involve her in those things. Now, if not her, she has her first trimester ultrasound in just 2 weeks. and has periodic maternal health and maternal health clinic appointments since the discharge. So she's getting discharged today. Since the discharge, you please go ahead with the maternal health clinic appointments. And she has first trimester ultrasound, all these things. We have specified those requirements, discharge requirements, discharge plan here in the last paragraph. So we have 3 paragraphs here. The first paragraph is about the habits, the history. The second is the most recent history. So we have separated that. If you can some prefers to write it together, but I don't prefer so I just separated it. So and the last requirement paragraph, it's very vital. We have to instruct the new community health nurse about these things, and we have done that. And the closing is done, and that's all about this VINEYARD. Later, I hope you all understood. Have a nice day. Thank you. Bye.